What we do know is that mental health problems are still a workplace stigma. Interestingly, over the last couple of years, there have been several surveys, different countries, different cultures, surveys within particular workplaces and general population surveys, and they've all got pretty much the same results, and they suggest that a little under half, around 40% of workers have experienced mental health problems and not told their employer. And when you ask them why, more than 50% of these people say that they feared for the impact it would have on their job security and or their career prospects. But of course, what also impacts on career prospects are noticeable drops in performance, which are sometimes sufficiently great to lead to someone's termination on grounds of, their capacity. Unaddressed mental health problems in the workplace also lead to relationship difficulties, which are very noticeable and also have an impact on career prospects. And of course, that's saying nothing about safety issues and the safety of your mates. The second point, and it was made by a number of speakers today, and Graham Martin reiterated it for us, is that most people who die by suicide are of working age. They are your workmates. And mostly they are men, 25 through to 65. But, and again Graham made this point, and we've heard a lot about suicide prevention programs in the second set of speakers, and we're now around the world developing second-generation suicide prevention programs. Everyone's doing that. We've learned from what's gone on in the last 15 to 20 years. We are refining the second and producing the second-generation suicide prevention strategies. But even so, very few, if any, of these new national strategies for suicide prevention target the workplace as a prioritized site for suicide prevention, or target men of working age as the prioritized population. But workplaces are really important. They offer people who are under stress, people who have distress, who have problems, a refuge from problems at home, marital relationships, problems with the children, for example. They offer an opportunity for connection, which a program like Mates in Construction exploits. They offer an opportunity for self-esteem, a role, an identity, and a purpose, a relief from rumination, a time out, if you like, from rumination about the problems that are distressing them. And I was talking at morning tea with someone, and Graham Martin also referred to this. Workplaces are particularly important for men, for whom their masculine role is defined very largely by their occupation. And I think we are moving into an era, an economic environment, and we may hear more about that from Professor Doran this afternoon, which is going to be different from the economic and working environments we've had in the past. We're not going to bounce back from depressions. The global financial crisis means that we have unemployment and underemployment. We have a move away from traditional manual jobs into service industries. It's no longer a job for life. We have deindustrialization, and all of these things mean that the workplace is changing, and it's a very important place in which to address mental health problems and the mental health problems that some of these workplace and economic changes are going to bring. And workplaces are also important for men because men tend to have fewer social relationships than women, and the social relationships that men tend to have tend to center around their workplaces and their workmates. We've heard a lot today about gatekeeper training programs, and Mates in Construction is an example of that. And these training programs are very important because men are not good at seeking help, and Graham talked about that. And I may get myself into trouble again, but I've argued for a while that we perhaps had a misplaced focus on promoting help seeking. And what we have to actually do is work at making it much easier for men to accept help. And I keep saying to people, we can't pull men to services. We have to push services to men. And I think that's why going to where men are, workplaces, sports programs, and after that we're going to go into the bars and pubs, is where we get our gains with men. You won't pull them to services. I just want to give you one example from my experience, which had a very powerful impact on me. And I did a project years ago where I took 300 people who'd made medically very serious suicide attempts, nothing like Kevin Hines, but medically serious attempts. And I've actually followed them up for 20 years. But in the early days, I went out and I interviewed them in their homes. And I went to see this one young man, and he was very depressed. I did my interview with him, and it was clear he was very depressed. He was suicidal. He had been depressed for a long time, so depressed he dropped out of his work. And so I obviously couldn't leave him and like that, and I tried to persuade him to get help. Had he, would he go and see an elder? He was Maori, a kaumatua. Would he go and see an auntie? Would he go and see his GP? Would he go and see, and I offered him a range of things. No. And he clearly hadn't done so for months and months, and he refused every offer I made him. So I said to him, what about if I go to your GP and I tell your GP, with your permission, everything you've told me? And then when you go and see him, you won't have to say anything because he'll know what you're there for. Okay, he said, I'll go with that. So it was 5 o'clock when I left his place, rang up the doctor's nurse and said, can I pop into the surgery, before the doctor starts seeing patients tomorrow morning, because I just want to chat to him about one of his patients. When I got there the next morning, there's this guy, 8 o'clock in the morning, sitting in the gutter outside the doctor's surgery. So I thought I was brokering assistance, but now I've been with mates, I realised I was actually being a connector. But that was actually very powerful to me. And again, it emphasises the fact that you have to find ways of making men accept services. And finally, I just want to talk about Sean's talk about QPR and sport. I think that's, as Sean said, an unrealised opportunity. And as I said this morning, with Kevin Hines, visible champions for lived experience and people with mental health problems are incredibly important in moving this field forward. And I think that we need the same thing with people like John Kerwin, who are champions, sports personalities, who really do speak to a wide sector of the population. And John Kerwin, as Sean said, has done an incredible job spearheading the National Depression Initiative in New Zealand, and for which he's actually been knighted. But again, I just want to tell you one story. Again, in Christchurch, we have construction workers who've been flying in to fix the place up, and they fly down from Auckland on a Monday morning, fly back on a Friday afternoon. And I was in the airport a few months ago, and there was a bunch of these guys ready to fly out on Friday afternoon, and they're sitting around having a beer, and they're talking about one of their mates who hadn't come down that week because he had a whole series of problems. And they said, I think he's got a touch of the JKs. And I thought, that was just amazing. They didn't say depression, and I listened when my ears pricked up. They never mentioned depression, they never mentioned suicide, but from the discussion about this guy, they were really concerned about him. And I thought, we've actually achieved a culture change where men have taken the National Depression Initiative, they've translated it into a term that they're happy to use, which is a touch of the JKs means he's got depression. And that's really what we need in this business. It's a culture change, and we need to exploit the opportunities we have for that. And sports programs are an area in which we can work. Thank you very much.